Welcome to StudyMEDIC. In this Study MBBS, your destination for career excellence. So I am your mentor, Dr. Prathap. In the MBBS, I am dealing with the subject called anatomy. But in this session, I'm going to tell you how to integrate and interrelate the three basic medical sciences subject, that is anatomy, physiology, and biochem. So overview of the subjects and how they interrelate with one another, the basic medical sciences. So congratulations on taking the seat, that is MBBS seat. It's the most prestigious and most respected field among all professionals. Congratulations for that. In this, we have 4 phases in MBBS. The first phase includes the basic medical sciences, which is the anatomy, the physiology, and the biochemistry. These are the 3 basic medical sciences subjects. So what is basically anatomy? Anatomy deals with, you can see here in this, there is a brain, there is a thyroid gland, lungs, heart, liver, stomach, so kidney, intestines, urinary bladder, uterus. So basically all these systems are made up of some tissues. So what is those tissues? What are those tissues? And how it is going to be made up of, or how it's going to function? Basically, that is called as anatomy. Whereas physiology is again the same structures which are there, but how it's going to function, how is the heart going to function, how is the lungs going to function, how is it going to work, basically that is physiology. In biochemistry, individual tissues and cells, how is going to, the cell machinery, how it's going to work. So in these various subdivisions also we have got, that is the metabolic pathways, the basic molecular biology within individual cells, and how in cancer they are going to respond, how in infection they are going to transform, and what are the basic structure of the macromolecules like carbohydrates, proteins, and lipids. And also we'll study in detail about the vitamins and minerals, the water soluble vitamins and minerals. What is their biochemical functions in the human body? What is their role in the human body to maintain the normal functioning of this human body and this machinery? And what if they are not there? What is going to happen? All this we are going to study in biochemistry. So these are 3 basic subjects: anatomy, which is a structure; physiology, which is the function, how it works at a macro level; biochemistry is at a microscopic level or a cellular level, at the level of enzymes. Each and every molecule we are going to study in detail. So the Medical Council of India, which is now called the NMC, has revised the curriculum after a long time. And in this curriculum, what you're going to see is CBME, that is competency based medical education. So in this, how we are going to interrelate each and every subject. Okay, you study about anatomy, you study about physiology, you study about biochemistry. Before it was, you will study separately. Now you have to integrate and study. You have to study the anatomy, physiology, and biochemistry of the same part, and you should be able to apply that in the patient so that you can find out an abnormality and what exactly you can do whenever you see such abnormalities. This you will be able to understand once you finish this session. How to go about studying anatomy, physiology, and biochem. So we have to align ourselves and integrate the subject, the alignment and integration. What is the most important subdivision of CBME, competency based medical education, where in we'll align one subject. I'll give you examples also in this video. You can know, then you can go about this in a smooth manner once you understand this concept called alignment and integration. So let's see this. So the examples given by the NMC or the CBME alignment and integration topics are anemia, jaundice, diabetes, thyroid disorders, nutrition, febrile illness, tuberculosis, malaria, diarrhea, ischemic heart disease, polycystic ovarian syndromes. So there are n number of examples we can make out of the medical subject. These are just a few examples or indicative examples. I have also taken few of the examples and I have tried to integrate. So you'll understand the importance of integration over there. So how to interrelate the anatomy, physiology, and biochem, the structural aspect, the functional aspect, and the molecular level, how to integrate this. Almost 90% of the topics can be aligned and it can be integrated. Remaining 10%, because general anatomy, general physiology, and general biochem deals with their own basic things, so that cannot be integrated. But with that background knowledge, we can integrate almost 90% of all these three subjects. So let's see that. So in anatomy, for example, taken here the heart. So we know that the heart is present in the thorax, that is the upper part of the body. In the thorax, it is present in the middle area between the two lungs. Anteriorly, there is sternum. Posteriorly, there is vertebral column. So heart is there in the middle of the thorax. That is called as mediastinum. This heart is made up of four chambers, the two ventricles and two atria. Atria receives the blood from the body. The right atria receives the blood from the body. Left atrium receives the blood from the lungs. After receiving the blood, the atria is going to pump the blood to the ventricles. The right ventricle is going to pump the deoxygenated blood to the lungs for oxygenation, whereas the left ventricle pumps the oxygenated blood to the body. So this is what the four chambers of the heart do. So with this idea, the right atrium, right ventricle, you will get the orientation where exactly the heart is located and how is the heart is going to receive, how it's going to pump. So this much idea you got. So this heart is made up of basically three layers. The outermost connective tissue covering of the heart, the outermost covering of the heart is called pericardium. Whereas the middle thick covering, that is a muscle of the heart, which has got automaticity, that is called myocardium. The innermost covering of the heart is a simple squamous epithelium and it is called endocardium. So these are the three layers of the heart: outer covering, pericardium; middle, myocardium; innermost, endocardium. So this we will study with anatomy. Whereas in physiology, see how the heart is able to pump. The atrium is pumping the blood to the ventricles. The ventricle is pumping the blood to the body and to the lungs. So how is it possible? This is what we'll study in physiology. So there is something called SA node, that is a sinoatrial node, which has got the ability of automaticity. That is, it is able to produce the impulse by itself. And it will produce the impulse at the rate of 72 impulses per minute. Therefore, the heart beats, the entire myocardium will agree with the SA node and it will contract together. It will pump the blood 72 times per minute. Therefore, our heart rate also is 72 beats per minute. So how do you understand this? With basic, how the ions are going to enter into the heart, that is a myocardium of heart, and how it's going to leave the heart, producing an action potential. It is an electrical potential which is produced due to entry of ions in and out of the myocardium of the heart. So you can see a graph. A graph consists of, I'll just zoom in so that you can see more clearly. See, here there is a graph. There is something called zero phase, then there is an upstroke, then there is a plateau, then there is a downstroke, right? So why this occurs? Why this occurs? Because of entry of ions into the heart. So entry of ions into the heart results in depolarization, then that is positive charge ion like sodium, and then plateau, then there is repolarization. All this occurs because of entry and exit of positive or negative charged ions, resulting in an action potential. Moving on to the biochemistry, the biochemistry basically deals with respect to myocardium. I'm telling again, in the biochemistry with respect to myocardium, we have the myocardium. Each and every cell, myocardial tissue cell, has got enzymes in it. These enzymes will be inside the myocardium. Okay, whenever the myocardium undergoes rupture of the myocardium, when it occurs, when there is ischemia to the myocardium, when decreased blood supply is there to the myocardium. Why there is ischemia? Either there is a block in the coronary artery because of atherosclerosis, lipid deposit. The blood is not able to flow freely to supply the wall of the heart. That time there will be myocardial ischemia. So when there is myocardial ischemia, there is a death of the myocardial cells. When there is death of the cell, there is a release of the contents of the cell, which is nothing but the enzymes. So there are so many myocardial enzymes. So heart is not the only muscle in the body. We have the skeletal muscle in the wall of the skeleton and the smooth muscles in the wall of the gastrointestinal tract, respiratory tract, urinary tract. So how do you distinguish between the enzymes of the myocardium, that is the heart, and enzymes of the muscle and the smooth muscles, skeletal muscle and smooth muscle? How do you distinguish this? That's why you have to study biochemistry. In biochemistry, we have something called cardiac markers. That is, the cardiac myoglobin is the first to rise. You can see in the graph now. The cardiac myoglobin is the first to rise as early as the first 15 minutes. Then there are troponins, which are specific to the heart. Cardiac troponins, they are called as. They will rise in the next 15 minutes. They will rise. That is a black color graph is there, no? That one. Then there is CPK-MB. There are, that is creatine phosphokinase MB. That is the next thing to raise. That is within half an hour it will raise. So like this, if you know if these enzymes are raised, so when you take a blood sample and do the investigation, we know this person is going through MI or myocardial infarction, death of the wall of the heart. Now, once we know that myocardial infarction is there, we are able to treat the patient appropriately. That's why we have to know the biochemistry. So this is an example of integration, how once you study the heart, the chambers of the heart, their relation to one another, what what is the blood supply to that area, what is the nerve supply to that area. Sympathetic nervous system, for example, sympathetic nervous system will cause increased automaticity, increase impulse from the SA node, more heartbeat will be there, therefore more blood stroke volume will be there. When more stroke volume, more cardiac output, therefore blood pressure will be increased during sympathetic activity. Parasympathetic activity, parasympathetic nerve is the vagus nerve to the heart. When parasympathetic activity is there, the automaticity of SA node will reduce, so the heart will beat less, so stroke volume will be less, cardiac output will be less, blood pressure will be less. So this is how you know, based on the anatomical knowledge, how sympathetic and parasympathetic nervous system affect the heart, then functional importance of that, then biochemical, if at all this heart doesn't function properly, what is going to happen? Death of the cardiac myocardium. So how do you analyze the death of the cardiac myocardium? By enzyme assay. What are the enzymes which are specific to the heart? Because there are so many muscles in the body. So cardiac troponin marker, CPKMB, cardiac myoglobins. So this is how you should be able to integrate anatomy, physiology, and biochemistry. I have told you with one example of heart. Moving on to the next subsequent things. So how to interrelate the three basic subjects? Again, I want to give you one more example: anatomy, physiology, and biochemistry. How to interrelate these three subjects? So in this, I have taken thyroid disorders as the NMC has mentioned. So among that examples only I have taken. So thyroid is, what is thyroid? If somebody asks what is thyroid, thyroid is a endocrine gland. Where it is located? It is located in the anterior, that is the front part of the neck, inferior part of the neck over here. So anterior inferior part of the neck in the midline, the thyroid gland is located. What is the shape of the thyroid gland? It is butterfly shape. It's the shape of the butterfly. The body of the butterfly resembles the isthmus, whereas the wings of the butterfly are nothing but the lateral lobes. So this thyroid gland, endocrine gland, is shielding one pipe, that is the windpipe or the trachea. Thyroid means shield like. So this thyroid gland, what is it made up of? Now it is made up of thyroid follicular cells. You can see in the diagram, thyroid follicular cells. These follicular cell has got a protein inside it and in the lumen of the follicle called as thyroglobulin. Now, other than thyroid follicle, thyroglobulin, there are some cells between the thyroid follicle. What are those cells? Parafollicular cells. Para means by the side of. By the side of what? Follicle. Parafollicular cells. What is the thyroid gland supplied by? It blood supply from above, superior thyroid artery, from below, inferior thyroid artery. Superior thyroid is a branch of external carotid. Inferior thyroid is a branch of thyrocervical trunk of subclavian. So these are the things which you should know in anatomy. I'm not trying to scare you, but you should know what is a gland, what is the function, what is the, where is the gland located, what is the shape of that gland, what is the gland made up of. Then that gland is made up of these components. What is the role? Then what is the blood supply of that gland? Venous return of the gland. Superior thyroid, middle thyroid, inferior thyroid vein will be there. Superior and middle thyroid vein will drain into corresponding internal jugular vein. Inferior thyroid vein drains into both the sides drains into internal this brachiocephalic vein. The remaining veins drain into internal jugular vein, as I already mentioned. This is what is anatomy about thyroid gland. Moving on to the physiology of thyroid gland, that is a functional aspect of thyroid gland. Again, in physiology also, they're going to teach you thyroid gland. In biochemistry also, they're going to teach you. Anatomy also, they'll teach you. But once they teach you in anatomy or physiology or biochemistry, in any one subject, you have to open up all the three books and you have to study the thyroid. And by the end of the day, you should be familiarize yourself with the structural aspect, functional aspect, and enzymatic aspect of the thyroid gland. So that day you are finishing one gland, you will be satisfied with the learning process. So I'll teach you now the thyroid gland physiology. This thyroid gland has got two types of cells. Already I mentioned the follicular cells, which has got a thyroglobulin in the center, the parafollicular cells by the side of the thyroid. The follicular cell produce what is called as thyroid hormone T3 and T4. That is triiodothyronin and tetraiodothyronin. If there are three iodine, we call triiodo. If there are four iodine molecules, we call it as tetraiodothyronin. Now, these hormones is going to maintain the basal metabolic rate of the head to toe. Everything it's going to control. In this scenario, I'll just give you an example of the heart. So, thyroid hormone is required for what? Maintenance of normal heart rate. For digestive system, what is the role of thyroid hormone? It is help in maintenance of peristalsis. For nervous system, maintenance of neuronal activity. If this is not there, what is going to happen? The neuronal activity is going to dampen. The person is always sleepy. Peristalsis is not going to happen. The person will be constipated. Heart rate is not appropriate or according to the needs, it's going to reduce. So person is always lethargic. That is what happens when the thyroid hormone is not there. It helps in normal BMR, basal metabolic rate of each and every cell in our body actually. But here we are given few examples like the bone, muscle, helps in the bone growth. Okay. Now, other than thyroid hormones, there is other hormone I already told you. Parafollicular cell produces something called as calcitonin. Calcitonin helps in calcium homeostasis, that is maintenance of the normal blood calcium level. There is one more gland by the side of the thyroid, two pair of gland called parathyroid gland that produces parathyroid hormone, also called as parathormone. This hormone increases the blood calcium level, whereas the calcitonin decreases the blood calcium level. So parathyroid hormone, the parathyroid gland producing hormone, how it increases blood calcium level? By increasing absorption from the gastrointestinal tract, by reabsorbing, by helping reabsorption from the nephrons of the kidney, by resorption from the bone. From the bone, it will remove and increase the blood calcium. This is what parathyroid hormone will do. Calcitonin will exactly do reverse of this. That is, it prevents the absorption of the calcium from the gastrointestinal tract. It prevents the reabsorption from the nephrons. It prevents the resorption from the bone and instead deposits the calcium into the bone. So calcitonin reduces blood calcium. So this is what you have to know. There is a balance in the body called as homeostasis between the parathormone on one side and the calcitonin produced by the thyroid gland on the other side. So it helps in maintenance of calcium homeostasis. Calcium is required for two important tissue in the body. One, nervous tissue for the normal functioning of the neuron. Number two, muscle. For the normal nerve muscle contraction, muscular activity, calcium is required. This is what you have to study when thyroid gland is taught to you. Moving on to the biochemistry of thyroid. So we understood the anatomy part, the gross part. Then we understood the histological part in anatomy. Then we know now what is the function of thyroid hormone. Now we are knowing how this thyroid hormone is produced from basic molecular level, microscopic level. We are doing. So there is something called, please see this flowchart. There is something called thyroid follicular cells. Each and every cell is capable of producing a thyroid hormone. So inside that there is a protein called as thyroglobulin. So the thyroid gland requires a stimulus from the pituitary by TSH, thyroid stimulating hormone. This TSH comes and stimulates the thyroid follicular cell. Once the thyroid follicular cells are stimulated, there is endocytosis of the thyroglobulin. It will be taken into that, and then the thyroglobulin will come and reach one level where the tyrosine residue, that is amino acid tyrosine in the thyroglobulin, will the tyrosine residue, the iodine will be added to that. If one iodine is added to the tyrosine residue, it's called monoiodotyrosine. If two iodines are added, diiodotyrosine. So in the thyroglobulin, one monoiodotyrosine and two diiodotyrosine, when they come together, it is called triiodothyronin T3. It is a protein chain. Triiodothyronin. If two Diiodotyrosine. Diiodotyrosine. 2-diiodotyrosine. It's amino acids. Okay. When 2-iodotyrosine comes together in a protein, then it's called as tetraiodothyronine. It's a protein again. Tetraiodothyronine. What we call T3 and T4. Triiodothyronine and tetraiodothyronine. Both these will be there in the peripheral bloodstream. The tetraiodothyronine, once it comes to the peripheral bloodstream at the level of tissue, it will undergo deiodination to produce by peroxidase enzyme to produce triiodothyronine, which is the active form of thyroid hormone. So this is a biochemical part of thyroid hormone, how it is produced, how it is transported, and what happens ultimately to that particular chemical. I hope this is clear. First example I told you about the heart. Second example I told you about the thyroid gland. Once you understand both this, then we can correlate something called the differences between hypothyroidism and hyperthyroidism. What is euthyroidism? When you're normal, we call euthyroidism. Euthyroidism. When the thyroid hormone are reduced, it's called hypothyroidism. When it is increased, it's called hyperthyroidism. By just remembering one statement, you can remember this entire chart. The statement is thyroid hormone helps in the maintenance of normal basal metabolic rate of each and every cell in the body. So if you understand that statement, what does hyperthyroidism do? Too much of metabolism, hair loss will be there. Too much of metabolism in the fat of the eyeball, bulging eyes, exophthalmos will be there. There will be enlargement of the thyroid gland. Too much sweating because BMR is high, na? Too much sweating is there. Heart rate and all is more, rapid heartbeat. Person can feel its own heartbeat, palpitation. Then excessive metabolism throughout the body, ultimately weight loss to the patient. Frequent bowel movement, peristalsis, frequently using the washroom. Warm and moist periphery. If you shake hand, it will appear like a hot iron box. Then there are tremors in the finger due to excessive metabolism. There is tremors in the fingers. Then the nails will become soft. In hypothyroidism, because the BMR is low, everything will be lower side. Dry, coarse hair will be there. Loss of eyebrow hair, puffy space will be there. Accumulation of too much of fat. There is no metabolism whatsoever. Enlarged thyroid gland again because it's not functioning, therefore it is enlarged. Heart rate, metabolism, everything will reduce. Peristalsis will reduce, therefore the person is constipated. Of course, the weight gain is there because the fat is not getting burnt or BMR is not there. Brittle nails will be there and arthritis will be there for the patient. So once you understand the normal, the abnormal is going to become really easy. Hence, you have to concentrate on anatomy, physiology, and biochemistry. So in anatomy, I'll just tell you briefly. Anatomy is a science that deals with the structures of the present in the human body from macroscopic level to the microscopic level. Macroscopic is what visible in the eye. Microscopic, the tissues and cells which we have to see under the microscope. Basically, anatomy means anna means cut and studying that particular thing, cutting up and studying. So Latin meaning of this is dissection. So there are various subdivisions of anatomy: gross anatomy, microscopic anatomy, developmental or embryology, radiological anatomy, surface anatomy, genetics, clinical, and living anatomy. So basically, gross anatomy is studying the macroscopic level, and the reverse is microscopic anatomy, in which if you study the tissues, it's called histology. If you study a cell, it's called cytology. So anatomy is basically study of structures. In gross anatomy, we can call it as regional anatomy. If you study only this region, head and neck regional anatomy. If you study only the brain, neuroanatomy. If you study only the thorax, thoracic anatomy. Study only the abdomen, abdominopelvic anatomy. Upper limb anatomy, lower limb anatomy. Like this, based on the region, we can study regional anatomy. Systemic anatomy is studying one particular system in detail, like integumentary system of the body, circulatory system, the heart and the blood vessels, arteries, veins, lymphatics. Together you study circulatory system. Gastrointestinal tract, right from the oral cavity till the anal canal, if you study, that is called digestive system. That is called systemic anatomy, basically. Nervous system, brain, spinal cord, cranial nerves, spinal nerves, you study, that is nervous system. Then muscular system, all the muscles of the limb, torso, everything you can study together. Then skeletal system, that is the entire skeleton, bones, individual bones you can study. Respiratory system, nasal tract, ultimately tracheobronchial tree, and the alveoli of the lung is the respiratory system. So if you study the system wise, we can call it a systemic anatomy. Examples: muscle, if you want to study where the muscle comes from, like for example biceps, short head is coming from coracoid process, long head supraglenoid tubercle of scapula. Both the head join to form common belly that will go and get attached to the radial tuberosity of the radius. By that the tuberosity, radial tuberosity, where the biceps are attached. It crosses the elbow joint from front, so it can cause flexion of the elbow. It also causes supination of the forearm. Then bone, whenever you're studying, you can see the upper end of humerus, lower end of humerus. Just an example, upper end of humerus consists of a head, greater tubercle, lesser tubercle, intertubercular sulcus. What and all is attached over there. Lower end consists of a pulley called trochlea, rounded bulge, capitulum, medial and lateral epicondyle. It's just an example, not in detail. You'll study each and every one of these in detail. Histology is basically studying the tissues, and with the help of microscope here, we can see a beautiful Graphian follicle, and there is a ova in the center, the largest cell in the human body, and corona radiata. Everything is there. This is the histology of ovary. Microscopic anatomy or microanatomy. Embryology, study of one sperm and one ova after it forms a zygote, one cell stage, 2 cell, 16 cell, 22 cell, like this. Ultimately, entire embryo is formed. That is called embryology or developmental anatomy. So this is how the normal thing has to be formed. If it is not formed, then we can call it as congenital anomaly. There are various congenital anomaly, like the median eye, the cleft in the lip, intestine is exposed to the exterior, the limbs are not developed properly, phacomelia, cleft in the palate, brain is not developed, anencephaly. Normally, the brain has to develop like this. If it doesn't develop, then we can call it as congenital anomaly of the brain. Anencephaly. An means absent. Encephaly means inside the head. Inside the head, we have brain, that is absent, anencephaly. Radiological anatomy is studying the same anatomy without cutting through the patient by just taking a radiographic image like an X-ray, CT scan, ultrasonography, okay, MRI, like this. That is called radiological anatomy. Here we can see the white color shadow in the midline is called the cardiac shadow, and two black color shadows on either side, that is the lung shadow. You can see the clavicles, you can see the tracheal shadow in the upper midline, like this. We have to study the radiograph, the anatomical part in the radiograph, radiological anatomy. This becomes extremely important if you're trying to do surgical field. Surface anatomy, whatever is there in the depth of the body, we should mark it on the surface of the body. That is called surface anatomy, either through visible landmarks or palpable landmarks. You have to palpate and feel. So once you are thorough with surface marking, you will become a great surgeon because you know where to incise what structure. Clinical anatomy, application of the knowledge, whatever you read with respect to clinical aspect. For example, a patient is complaining here of a pain in the lateral 2/3 of the palm and lateral 3.5 fingers. Then if you palpate here, there will be one nerve in the midline, that is median nerve. Median nerve compression occurs in a tunnel called as carpal tunnel, formed by the carpal bones on the posterior plane and flexor retinaculum on the anterior plane. That is called as carpal tunnel syndrome. So how do you know all this? Based on anatomy. Once your anatomy is strong, you'll know all these things by default. In physiology, you have to study the interrelation. I'm not going to lengthen this. In physiology, for example, we are studying one system, how the blood pressure is regulated. Blood pressure is regulated by renin, angiotensin, aldosterone system. That is the example I have given here. Renin is a protein produced by kidney. Angiotensinogen, it's a protein produced by liver. Both are traveling the bloodstream. It is there every time. But whenever our blood pressure is abnormal, that time these chemicals are going to get activated in the lungs. There is something called angiotensin converting enzyme produced by pulmonary capillary that converts angiotensin 1 into angiotensin 2, which is a potent vasoconstrictor. If renin is produced by the kidney, the renin will activate the angiotensinogen into angiotensin 1. That angiotensin 1 will go through the bloodstream. It can go anywhere. It will go into the lung, pulmonary capillary. There, ACE enzyme is there, ACE enzyme. That angiotensin converting enzyme activates the angiotensin 1 into angiotensin 2, which is a potent vasoconstrictor. When there is vasoconstriction of blood vessel, the resistance is increased or decreased? Definitely it is increased. When it is increased, therefore the heart has to, workload of the heart will be increased, therefore blood pressure will be increased. This angiotensin 2 also goes and acts on the adrenal cortex, wherein in adrenal cortex it stimulates the zona glomerulosa to release aldosterone. This aldosterone goes and acts on DCT of the nephron. There it induces salt channel, that is sodium and chloride channel. So sodium and chloride is being reabsorbed in excess. What is sodium chloride? It's nothing but salt. When salt is reabsorbed in excess, the water also will be reabsorbed. Water also will come along with it. When salt and water are reabsorbed, what will happen to the blood volume? Salt and water is coming more. So blood volume also increases. When blood volume increases, the end diastolic, the amount of blood coming to the heart also increases. When the amount of blood coming to the heart, end diastolic volume increases, heart stretches more and it pumps more. Cardiac output will be more. So BP will also become more. So ultimately, activation of renin angiotensin aldosterone system causes increase in blood pressure. How? Angiotensin 2 causes potent vasoconstriction, increasing total peripheral resistance. The same angiotensin 2 acts on the adrenal cortex to release aldosterone, which acts on the DCT of the nephron, causing excessive reabsorption of salt and water. This salt and water, increasing blood volume and diastolic volume, increases cardiac output. Therefore, BP is directly proportional to cardiac output. So, therefore, blood pressure also increases. This is how we can interrelate. Each topic is for 1 hour. I am just doing the summary of that so that you can understand this in detail. Uh, so in physiology, we have to do this examination of each system separately. Inspection, whatever we inspect that particular area with the help of our eyes. Then palpation, we just have to palpate some blood vessels of the body, carotid blood vessel, radial blood vessel. Then percussion, we have to percuss the area. If we are percussing with two hands, middle finger of the right hand and left hand, if there is resonating note, then there is air inside that, that is lung. If there is dull note, that means there is blood inside that, that is heart. So resonating note is lung area, dull note area is heart area. Then we have to auscultate with the help of stethoscope. We have to auscultate and see what area is normal heart sound and what area is abnormal heart sound. If at all it is there, then what area is normal vesicular breath sounds and where it is abnormal breath sounds. So in inspection, we have to inspect with respect to cardiovascular system, chest wall abnormalities, position of trachea, apex beat, any other pulsation is there in the heart, any dilated in the chest wall, any dilated veins are there, any surgical scar which indicates previous surgery. So in palpation, we are palpating for the heart, apex beat of the heart, which is there in the mid-clavicular line, left mid-clavicular line in the fifth intercostal space. You can get the apex beat. Then we can percuss. We have to percuss from lateral aspect. We'll be hearing resonant note. Then suddenly dull note. That is the right margin of heart from right side. From left side, left margin of heart. Then from beneath near the apex beat, we get the inferior border of the heart. Then we have to draw one diagram that will become the cardiac marking because of the. If it is increased, what does it mean? It increased means heart size is increased. That is cardiomegaly. If it is reversed, that is dextrocardia. If it is normal, it is rotated to the left side. If it is reversed, then the diagram will be mirror image. That is called dextrocardia. That is the purpose of percussion. Auscultation, we have to auscultate in specific area. Second intercostal space on the right side, next to the sternum is aortic area. We'll hear the aortic valve closure much clearly. Then on the left side, second intercostal space, next to the sternum is the pulmonary area. We'll hear the pulmonary valve closure very clearly. Near the apex beat, we hear the mitral area clearly. Near the xiphisternal junction, we hear the uh, tricuspid valve area, the tricuspid valve closure very clearly. Lub dub, lub dub, lub dub. S1 and S2 heart sounds we can hear clearly. That is the importance of auscultation. Do you hear any other sounds? That all is murmur, or the valve is not closing properly. That means there is valvular abnormality. Moving on to the same application with respect to biochemistry, there are so much of metabolism of each and every pathway. I have taken one pathway as an example. There is something called urea cycle. What is urea cycle? Urea is a waste product of amino acid metabolism. The nitrogen has to be eliminated from the body in the form of urea, not ammonia. Ammonia in lower animals. In humans, it is urea. Urea is CONH2 twice. That is urea. This is a knowledge we should have. This takes place mainly in the liver. So if there is any problem in the liver, the urea cycle will be affected. This is the first thing you have to know. What is ammonia? Ammonia is a waste product of amino acid metabolism. What is carbon dioxide? Carbon dioxide is a waste product of each and every cell. So two waste products are there, carbon dioxide and ammonia. Both will join to form the carbamyl phosphate. What is the name of the enzyme? Carbamyl phosphate synthase. Enzymes you can guess based on the substrate or product. Very easily you can guess. Now this carbamyl phosphate, what you have already, carbamyl phosphate, ornithine will come. So ornithine will be transferred to carbamyl phosphate, ornithine transcarbamylase. Once it is transferred, there is a formation of a molecule called citrulline. Then citrulline will become arginosuccinate. That you have to remember. When the aspartate molecule from a TCA cycle, Krebs cycle or tricarboxylic acid cycle comes, aspartate it joins with citrulline to form arginosuccinate. After that, the arginosuccinate will undergo the name of the enzyme is very simple, arginosuccinate synthase, and here it will be arginosuccinate lyase. So this arginosuccinate lyase, once it forms arginine, it will become degraded by the help of arginine arginase. It's just a lyase. You can tell arginine lyase also, no problem. Arginase or arginine lyase. Then urea will come out as a byproduct. You will get back your ornithine so that the cycle continues. You will keep regenerating ornithine. Otherwise, there will be exhaustion. Ornithine will go means urea cycle will not continue. So you'll get back your ornithine what you invested before, and the urea will come out as a byproduct. This urea is eliminated both in the stool and in the urine. It will go out and it will be available in bloodstream 30 to 45 milligram per deciliter. This is the importance of urea cycle. So what happens if this urea cycle goes wrong? If there is a problem in urea cycle, then the level of ammonia in the blood will become, definitely it will be raised. Then the condition is called hyperammonemia, where the ammonia is in excess in the bloodstream. Once it is in excess in bloodstream, it can cross the BBB, blood-brain barrier. It can reach the brain and can deposit in the brain. So once it enters the brain, it stops the most important cycle in the brain, that is TCA cycle or the Krebs cycle. Depleting the metabolites, especially the alpha ketoglutarate, will be depleted, resulting in lack of energy, lethargy. The person is almost comatose stage. He will be like very tired, excess tired, is bedridden. Why? All these neurological symptoms is because of why? You can just think there is lack of energy. Energy is given to the brain neurons by Krebs cycle. It is not working properly. Why? I told you that aspartate, okay, that will be detached from the TCA cycle. Once it is not working properly because of the liver problem, this guy may be an alcoholic, that results in neurological symptoms. So the problem can arise as a result of damage from the liver. Already I told you, that is cirrhosis or alcoholic liver diseases. Then it can also be without an alcoholic also they can get this problem, that is because of inborn errors of metabolism called urea cycle disorders. Usually this occurs between 24 to 48 hours after birth. Okay, that is in newborn child. The most severe symptoms are seen in newborn with the defect of the first enzyme, carbamyl phosphate synthase, that enzyme, because both the waste product will be accumulated. Carbon dioxide is accumulated as well as the ammonia is accumulated. So the treatment of hyperammonemia consists of removing the excessive protein from the diet. We don't want protein. Already excess protein is accumulated in the patient's body. So excess removed and already accumulated ammonia has to be removed. So how we can remove that? Give sodium benzoate, sodium acetate. It will act as a chelating agent. It will neutralize the ammonia and remove it, okay, through the feces. A sugar called as lactulose can also be given. When we give that sugar, it is not absorbed from the GAT. It will take up the ammonia produced by the gut bacteria. It will clear that and it will eliminate it in the stool. And also we can give antibiotics. Antibiotics also kills the bacteria which are there in the GAT, removing the ammonia producing bacteria. So already the ammonia is in excess. That excess ammonia has to be depleted. We don't want again ammonia production. We don't want to give protein because protein contains ammonia. Amino acids means amino means ammonia. So we restrict the protein diet for the patient, and what is accumulated we'll eliminate either by stool or urine by giving various substances like sodium benzoate, sodium acetate, lactulose, so that the ammonia will be eliminated. Once all this is done, the patient will recover from the coma. That is hepatic encephalopathy is going to recover. So there will be assessment at the end of every part. It's called part completion test, and internal assessment once in 3 months, and final examination at the end of the academic year will be there. Attendance is mandatory, theory and practicals 80%. I expect 100% attendance so that you understand all the topics clearly. And internal assessment minimum 40% marks in theory, 40% in practicals. Overall theory and practicals put together, you have to get 50. So if you're thinking of getting 40 in theory, that means you have to get 16 practicals. Then only aggregate will be 50. Thank you very much. This is just a brief introduction video. I gave you too many examples, I believe. So don't panic with that. It will be a trigger for your further learning. Thank you for the opportunity.